Just another day with the dumbest men on planet Earth in charge of every aspect of our life here in the United States. And it brings me no joy to share that there is a ship sitting off the coast of Africa right now with dead passengers on board. And international health officials are currently tracking travelers who have already caught connecting flights back to the United States. And you would think, you might think that the person in charge of American health would be moving heaven and earth to establish some sort of containment strategy. But no. And if you're a millennial, congratulations. This is our second incoming pandemic. This is our second chance at another plague. Boomers, they got Jonas Salk, and we and Gen Z and Gen Alpha, we get to experience the rush of another new first. Another plague, but this time with the joy of a man who ate a parasitic bear brain and raccoon, not just any raccoon, roadkill raccoon, in charge of stopping it. And when I tell you what his shocking new strategy is for all of this, you're going to miss who you were before I told you. I'm so sorry. And in all seriousness, Hantavirus has a 35% mortality rate. To put that into perspective for you, COVID-19 at its absolute worst sat around 1 to 2%. We are talking about something 30 times more lethal. A respiratory virus with no vaccine and no treatment that can turn your lungs into a sponge within 48 hours. This is so much more than Red 40. Okay, you guys? So I need you to lock in. RFK Jr. looked at this and said, best I could do, best I could offer the United States of America, more dead animals. I am not kidding. Instead of literally doing anything responsible or, God forbid, science-backed, the official federal response for a 35% fatal outbreak involves something so fundamentally weird, you're going to be like, Lauren, you're making that up. And I'm going to tell you exactly what the Secretary of Health and Human Services thinks is more important than a quarantine plan. It involves a reality TV chef and a 15-minute conversation about pigeons. And again, I am so unfortunately serious here. Welcome to another day in the worst, dumbest timeline ever. And real quick, I'm Lauren Paritra. Willa and I run this every single day. And if you've been listening for a while, you know the drill. And if you're new here, we do this all for the thrill of humbling the worst people ever. More specifically, Katie Miller, who married Stephen Little Bitch Miller, who, by the way, appeared at the Met Gala last night. Surprise appearance from Stephen Miller. If you're listening, we're going to be playing some B-roll of him scurrying across the red carpet. So quick and so slithery, they almost missed him. And we're going to ask for your help in hitting 100,000 subs. We are so close. And once we hit it, y'all are in charge. You can dictate whatever you want for the bonus episode. Just take a moment to subscribe. Follow wherever you get your podcast. Follow us across social. Leave a review. So let's get these numbers up. Even if you don't like me, do it for Willa. Help us hit 100K. Do it for the girly. Okay, so back to the doom. Hantavirus travels through the air. And if that's sounding familiar to you, it's because it is. It's not something you can get from a cough or a handshake, which is infinitely scarier. You can contact it breathing while you're doing something as mundane as sweeping out a garage or opening up a summer cabin. When you disturb dried dust of rodent droppings, the virus becomes aerosolized. You breathe it in and you feel absolutely nothing. And symptoms do not appear for up to 8 weeks. So by the time you actually start feeling sick, the virus has been replicating inside your body for 2 months. Then your lungs fill with fluid, often within 2 days of your first cough. And the American public seems to understand these stakes because we've seen this happen to people who should have been protected in theory. Betsy, Gene Hackman's wife, died from hantavirus pulmonary syndrome in their Santa Fe home in early 2025. She had access to essentially every resource money could reach, including private medical care and the best doctors, and it did not change what happened. The virus does not negotiate based on your tax bracket, based on your age, based on what you have access to. And we know that there's slum lords running rampant in this country. So I really have concern for people who are living in densely populated areas, people with slum lords, people who don't have control over the environment they're living in. And people in New Mexico and Arizona have been living with this fear for years. Those states are hotspots, and the families living there have been begging for any sort of basic federal guidance. They want to know how to safely clean an outbuilding, what kind of protective masks actually work against aerosolized particles, or what exactly a flu-like symptom looks like before it becomes an emergency. This is the kind of basic life-saving information a functioning public health agency is supposed to provide as a matter of routine. They are still waiting for all of it while RFK Jr. is cooking up this. And real quick, today's episode is brought to you by Cozy Earth. I do everything from home, including the research, the writing, the checking the ceiling for Stephen Miller. At some point, I realized the outfit I was doing all that in deserved to be a little better. So their jogger sets are made from the softest material I can find. And I have reached for mine every single day since it arrived. They make me feel put together enough that I don't feel like a person who just gave up altogether, but they are comfortable enough that I never want to take them off. They work for taking Willa for a spin, taking Willa to Potty Town, getting my mail, doing errands, filming, just sitting on the couch. Everything on Cozy Earth comes with a 100-night trial and a 10-year warranty. So you can head over to cozyearth.com and use my code Lauren, that's Loren, for 20% off. And if you see a post-purchase survey, tell them you heard about it right here on LPTV. You're not going to believe this. What RFK chose to do while those families wait, the MV Hondas is currently moored off of the coast of Cabo Verde. There are 7 confirmed cases and at least 3 dead.
I am currently on board the MV Hondias, and what's happening right now is very real for all of us here. We're not just a story. We're not just headlines. We're people. There's a lot of uncertainty, and that's the hardest part.
International health officials are frantically trying to locate every passenger who boarded a connecting flight before the quarantine was established. Some of those passengers are in the U.S. right now. The window for containment is closing, and this is the exact moment a health secretary is supposed to step in front of the camera and tell the country he's going to stop this 35% fatal disease from hitting our soil. RFK Jr. is the person running the Department of Health and Human Services. While the window for containment closes, he has stayed busy. He froze $600 million in global vaccine funds. He systemically scaled back CDC public health communications. He cleared out a significant number of experienced scientists who have spent their lives managing outbreaks. A federal judge recently threw out his hand-picked vaccine advisory panel because, the members weren't qualified to sit on it. His personal pick for Surgeon General had never held a medical license and had never seen a patient in a professional capacity. Oh, and we're still not done, because what he put in place of all of that institutional knowledge is some good old-fashioned grift, and it's weird. So Kennedy says he's doing this to bring in independent doctors, but we need to be clear about what independent means in this context of doctors. A doctor who is, air quotes, independent presumably means they aren't affiliated with hospitals or any sort of academic peer review, and is therefore a doctor who answers to absolutely nobody, meaning they have no oversight board or colleagues checking their work, and somehow it gets worse. Here's where it gets so strange, and where that plan comes into play, which I'm going to show you in just a moment. Kennedy frames institutional medicine as a lie. But institutions are the reasons why we know cigarettes cause cancer and why we pulled dangerous drugs off the market. When Kennedy says independent, he usually means somebody who was pushed out of mainstream medicine and who found a more profitable audience by selling supplements or grift du jour. This brings us to the actual federal response. When the public started demanding a plan for the Hantavirus outbreak, or when the people in Arizona and New Mexico wanted to know how to not die while cleaning out their barns, Kennedy finally broke his silence. And you know what he did? He launched a podcast. I cannot even say this to you all with a straight face.
I'm Robert F. Kennedy Jr., your HHS secretary. This podcast is about telling the truth, especially when it's uncomfortable. I'm going to have fearless conversations with critical thinkers, including independent doctors, respected scientists, and leaders in medical innovation and research.
It is called the Secretary Kennedy Podcast. The teaser features foreboding music, and Kennedy looking directly into the camera, promising radical transparency in conversations with those independent experts. If you were expecting a briefing on quarantine ships or advice for people in endemic regions, you're going to be disappointed, because the debut episode featured a reality TV chef who was famously fired from the Food Network for fabricating his entire resume. The specific lie that he made was that he made the wedding cake for Princess Diana. He definitely didn't. He did not do that at all. And on the podcast, he and the Secretary of Health and Human Services spent their time discussing lower sodium chicken options at a military dining facility in Texas. Also in Texas, plenty of elementary school students getting plucked off the street. 2 just this week, plucked off the street into straight up into detention centers. But, let's just gather around and talk about chicken. The chef also sells a line of protein bars made with the exact ingredients Kennedy's entire public health agenda identifies as poison. Neither of them mentioned this.
Why are we not using dark meat? Why are we not helping people understand those cheaper cuts of meat or cheaper vegetables?
The second episode is 15 minutes long. The guest is Mike Tyson. They spent the opening minutes of the official HHS podcast talking about pigeons.
Sometimes I forget. I don't know why I love them so much. I just love them. And anybody that has pigeons, I didn't mean to interrupt, but anyone that has pigeons, they understand how I feel.
Yeah. And, you've been through everything like me. You've been through ups and downs in your lives. And there must have been times in your life that you were just soul crushed.
Tyson then describes what it sounds like to have a disordered relationship with food, telling the secretary that he refuses to eat when he doesn't like his current weight. Sounds like a really healthy relationship with food to platform in a productive way, which I'm going to go ahead and say it probably wasn't a productive conversation. Probably didn't have any lick of medical or clinical experience or counseling involved in this at all. And Kennedy, who is responsible for the nutritional health of the country, does not follow up on this. He just listens and nods his head. And Kennedy would probably eat a dog if no one was looking. Him and Christine, match made in heaven. So while the Hantavirus is liquefying lungs in New Mexico, Kennedy ate a parasitic bear that he found in the park, just a dead bear that he found in the park. And he also found a raccoon run over on the side of the road and ate that. He didn't just eat that. He ate its peen. So that's who's running our health policy right now. And look, I know doctors. My friends are much smarter and much more brilliant than I am. And what one of my friends who's a physician said to me is, she said, we were the kids. She was one of those kids who could have gone into finance or tech and made obscene amounts of money doing basically nothing but exploiting the labor of others. But instead, they spent decades in training, took on debt that would make most people cry, and dedicated their lives to keeping strangers alive. So at the very freaking least, let's put some respect on their names, please, okay? The current media environment, what it's figured out is that you can just validate anyone. You could just put a guy who thinks vaccines and Tylenol cause autism next to an immunologist. And suddenly, 40 years of peer-reviewed research becomes just one opinion amongst all the ding-dongs online. The thing about science is it doesn't care what you believe. It's going to work either way. And it is going to work whether you understand it or not. Hantavirus has a 35% mortality rate. None of this should surprise anyone. We've just accepted that this is what it looks like now. This is where we're at, and this is not okay. So while y'all are tripping about red 40, maybe this should just bother you just a little bit. And if it bothers you and you're with me on this one, share it. Share it with somebody. Talk about it with somebody. The least we can do is stay informed and try to keep each other safe. That's the least we can do, because the people who are supposed to be doing that have a new episode dropping next week. And again, I'm Lauren Paritra. Willa Paritra needs acupuncture. Mama needs a break. We really are with you, and let's hit 100K. It's only another time before every single grifter on the planet has a pod, and we can only fight them so much on our own. So we're in this together. Leave us a comment, 6 words or more. Find us across social. Give us a 5-star rating wherever you listen to your pods, and we'll be back with more.